All right, here we go. Happy
Aariyana,
Tuesday,
you went black.
everyone. Oh, there you
We
go.
go.
Yes,
So
like, wait.
sexy, that lighting.
Yes. Welcome back to Trendy Tuesday. We had a week off last week because Dr. Yan was doing other important doctor things, but now we're back and better than ever. Tonight we are talking about birth control and how it relates to pregnancy. So we have a couple questions to answer based on trending topics. As always, if you have any questions, feel free to leave us a comment and we will either get back to you now or a little bit later after the live. Tonight, I am joined by Dr. Yen, our CEO and co-founder, and the lovely Aariyana. She's going to be my co-host tonight, and she's one of our, oh no, she's one of our new interns. Maybe the Wi-Fi. She'll be back. We'll just keep the show on the road. Okay, so we are going to get started. Oh, also follow us on all social media at Pandia Health on all of our socials. So without further ado, oh, she's back. She's back. Great. Let me add her to the stream. And yeah, you know what? I'll ask the first question, then we can just go from there. So, first question for tonight. There you are. Sorry about the technical difficulties. Okay.
You're fine.
So
It's fine.
Perfect. I'll kick off with the first question. So, how long does it take for birth control to start working? And if I think what the trending version of this question is if I'm sexually active and I start taking birth control, when can I start to worry less about pregnancy? Can I worry less about pregnancy? That's kind of what this
yes. So if you go on the birth control pill patch ring and certainly the IUD and implant and all the long-term methods, you can start, decreasing your worry about birth control because you've chosen a more long-term prevention of birth control than just using condoms or spermicide or something that just only works for one day or at the exact moment that you use it. How soon it works depends where the person with the uterus is in her cycle. So if you are bleeding right now and you start your birth control method, the pill, the patch, the ring, I'm not going to speak to the other methods. The pill, the patch, the ring are the ones that we're going to address here and now today, because those are the ones we can prescribe and deliver at Pandia Health. Then theoretically, it could start working within 2 to 3 days. But if it were me and I just don't want to be pregnant, if any chance possible, the first time you start the pill, patch, ring, I would, use a backup for a month. But after you've been on it a month and you just keep going and you don't miss anything and you're all good, then you can just go forever. But I would, theoretically, and according to the science and the research, 2 to 3 days. 3 days to be absolutely safe. And then I would do a month because I'm just that anal. If you want to be, middle anal, then you can be in between. So according to the science and research, 3 days if you're on your period. If you're not on your period and you're just starting randomly somewhere in your cycle, then 7 days after is the science. And then again, me being paranoid because I don't want anybody pregnant that doesn't want to be pregnant, just back it up for a month. Okay. So the science versus the don't get pregnant. Those are the two options.
Totally. Yeah, that makes sense. We also have a blog post on this actually. If you go to pandiahealth.com/blogs, there's a little search bar and you can literally type in when will my birth control start working, and there's a whole article on it. So if you would like further information, feel free to do that. But that's really good to know. All right, Aariyana, if you'd like to kick us off with our next question.
Yes. So this may be a bit off topic and everything, but so the main question I think a lot of women just want to know is, how does birth control relate to blood clotting, and how effective is birth control even to, prevent it or, make it happen for some women? I know women have different bodies and everyone's, completely different. So, and I actually wrote an article for Pandia Health about it. So I was wondering, Dr. Ann, if you could, kind of go into detail about that and just people who are afraid to start birth control for that reason.
So, definitely, this is something when you start birth control, you have to weigh the risks and the benefits. And the risks of being pregnant increases your risk of blood clots far more than being on the birth control pill. certainly if you're not on the birth control pill at all, your risk is low. And then your risk on the birth control pill, I think, triples your risk. But again, it's tripling. I think it's like 1 out of 100,000. And so now you've gone to 3 out of 100,000, but there's 9,99997 people that could benefit in exchange for the risk of a blood clot. And just because you have a blood clot doesn't mean that you die. Most of the time you don't. And it is a bad thing to have a blood clot when you don't need or wasn't going to have one in the first place. And it certainly is possible to die as well. It depends. If you have a family history of blood clots, then you should probably get checked too, because there are things called protein S, protein C deficiencies that can cause you to have greater risk of blood clot. If you have lupus with antibodies that cause you more to blood clot, then these are reasons not to be on a birth control pill with estrogen. There are progesterone only pills. There's the IUD with progesterone. There's the copper IUD. But based on the science, the risk of blood clot when you're taking the birth control pill compared to being pregnant is lower. I think the risk is like 10 out of 100,000 versus 3. So that's the difference there. And then not being on anything is like 1. So 10, 3, and 1 out of like 100,000, I believe. But you can Google it. But it's I think that's the approximate difference. And it's also the benefit of preventing unplanned pregnancy, the benefit of lighter periods, the benefit of decreased ovarian, endometrial, colorectal cancer. So the benefits in general outweigh the risks, but each person is different. And if you have a family history of blood clots, definitely get some blood tests and get that checked out. And if you have the signs of a blood clot, would be a blood clot in your abdomen. So you have some horrible abdominal pain that lasts greater than 20, 30 minutes. If one of your legs swell up, that could be a blood clot in your leg. If both your legs swell up, it's something else and you still should go see a doctor, but it's not going to be a blood clot most likely. But if one leg swells up and you didn't bump into the wall or something like that, then that could be a blood clot there. If you have the worst headache of your life and it lasts longer than 10, 20 minutes and you didn't just go bang your head against a wall or take some drugs or something like that, could be a blood clot in your head. And if you have chest pain, you're like, ugh, and you can't breathe and whatnot, that could be a blood clot in your lungs. So we call this, there used to be a mnemonic for it. There is a mnemonic and I'll get back to you and put it on the video later, but it is a mnemonic. Oh, aches, abdominal, chest, headache, eyes, and swelling. So if any of those things happen, go to the ER, tell them you're on a birth control pill, patch, ring, and which one it is. Though really, they just need to know that you're on estrogen and you're at risk of a blood clot. But the risk, again, is lower than if you were pregnant. And certainly if you're a smoker in 35, then you shouldn't be on an estrogen-containing method of birth control, because then the risks outweigh the benefits.
Gotcha. Okay, no, that totally makes sense. And it's good to know that there's actually a smaller percentage of women who get blood clots from birth control versus pregnancy. And part of the reason you go on birth control is to prevent pregnancy, but there's also those other benefits. So that's really great. Speaking of pregnancy, our next question is, if you are on birth control, should you still regularly take pregnancy tests if you're having sex? If you're not having sex, don't worry, disregard this. But if you are having sex, should you take them regularly? Yeah, I'm like, wait, let me think about that.
Yeah, but if you're not having heterosexual relations, then you don't need to take a pregnancy test. If you're not having, if you're masturbating, mutual masturbation, or oral sex, you don't need to be checking it. I would only check a pregnancy test if you're taking your medications the way they should be taken. If you are choosing to have a withdrawal bleed every month, every 3 months, or every 6 months, and when you do that withdrawal, you don't bleed, then that would be a concern. But there are some women on lower birth control pills that just go to no period because the hormone is so low on those that they don't have this withdrawal bleed, or they don't have enough estrogen to bleed at all. And then the signs of pregnancy, I would say the first sign of pregnancy is breast tenderness. And the example I give is I went off my birth control pills and I was going to get pregnant. I'd been on it for like 15, 20 years. And then the second month after going after it, a couple days, and then in the middle of the night at like 3 a.m., my breasts hurt. And normally my breasts have never hurt in my entire life. Like other women, their breasts might hurt during their periods, or I don't know what. I've never had my breasts hurt. My breasts were like, bonk, 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 bonk. And I ran to the bathroom, peed on a stick, and it was a positive pregnancy test. And that's like the soonest possible, like had sex, and then like 5 to 7 days later, blam. So first sign is breast tenderness. Other signs are nausea, vomiting, weight gain, lower abdominal just keeps getting bigger. Those would be signs that you're pregnant. But if you're taking your birth control pill regularly, you don't really need to do a pregnancy test. And another way to test it is if you're on the pill to patch the ring and you're skipping your periods, the patch, you have to have a withdrawal bleed every 12 weeks. But if you're on the pill or the ring and you're just going continuous, if you're worried, you can come off your method for 4 days and you should bleed. If you don't bleed, then check a pregnancy test.
Gotcha.
So you can either bleed or check a pregnancy test. I mean, pregnancy test you can get at the dollar store for $1 or $2. So maybe it's worth $2 rather than having to bleed, because I hate bleeding.
Absolutely. Absolutely. I feel the exact same way too. And just to piggyback off that question as well, what do you think about, I know this is, a major thing that a lot of young girls who, have just started their periods want to know, I guess, the secret. Does birth control help with, I guess, like other contraceptive methods? So do they work together? Like, let's say condoms and, different things like that. Do those two work together in a way that they increase or decrease their chances of getting pregnant?
So if you use 2 forms of birth control, I don't recommend using 2 hormonal forms of birth control. So I've had people on the IUD and they're like really anal and don't want to get pregnant. So then they'll throw on birth control pill. And I was like, you are just too much hormone, my friend. Or implant and birth control, or definitely no one in their right mind would do IUD and implant. But if we're talking barrier method, I absolutely recommend condoms plus a hormonal method, or condoms plus the copper IUD, because this one also prevents against sexually transmitted infections. And the number one sexually transmitted infection is human papilloma virus. And although there's a vaccine, it only covers 9 out of 160 different ones. So there's 151 that you are not covered in. And so the only way to prevent HPV is to use a condom. And if, we have 2 sexual partners in our life, we have like a 70% chance of having one of the 4 major HPVs. And out of 160, I don't know what the statistic is. And as a feminist, I also just recommend using a condom, because I don't like to leak semen for 24 hours. And I think if the person with the penis had to leak my fluid for 24 hours, they would sure as heck made sure that we use whatever the condom equivalent would be. So if you use a condom plus a hormonal method, the pill, the patch, the ring, the IUD, implant, copper IUD, that's great for sexually transmitted disease infection prevention, for leaking semen and badness. You can also use a spermicide. So that is not hormonal. It's just in your vagina and it kills sperm. And so you could use the 2 together. I'd say you don't need to use it with the IUD and implant, because those 2 actually work better than tubal ligation, which is snip, snip on your tubes. But with the pill, the patch, the ring, you could absolutely consider using spermicide with it. But it wouldn't interfere. The main risk is if you're putting 2 hormonal things together, then you increase your risk of blood clots.
That makes sense.
Good question.
To know. Yeah, no, that is a really great question. I think that's really something that a lot of people would ask. It sounds kind of self-explanatory, like, of course you're not going to take the pill and something else. But no, I mean, that's something that could get confusing, because the IUD is in you, whereas the pill you're just swallowing. So you might think automatically, yay, double protection, but that's a really good point. Not necessarily.
Yeah, especially, and then a lot of women, like for my age, I'm 22. So a lot of women my age are really, really, scared of getting pregnant, because it's just, it's a common thing. They're scared of getting pregnant because, we're just starting out college, our new careers. And so a lot of people too have asked me, that question of, am I able to take 2 methods of contraception? Like, is this possible? Can I be
condoms
extra?
and spermicide and this, but not 2 hormonal things. And the one thing you just reminded me is a lot of people like get happy with emergency contraception. So, I just say it's a lot of hormone, ladies. And so if you're on a good method and you're taking it regularly, you don't need to throw down some emergency contraception. Emergency contraception is if you use a condom and it popped. If you were, God forbid, sexually assaulted, or if you forgot 3 days in a row of a method when you should have been using a method, that is when you bring in emergency contraception. And at Pandia Health, we always want to educate people. If your body mass index is 26 or greater, Plan B and its generics do not work. So everybody, please, right now, Google body mass index, punch in your height, your weight, and just check. If you are 26 or greater, Plan B and its generics don't work. And so we recommend Ella. And so if you were to throw down Ella, which is a prescription emergency contraception, and you're taking your hormonal, then the Ella doesn't block the method from working, thank goodness. But if you were using it for emergency contraception and then you added your hormonal, then it would block the Ella from working. Because the way Ella works, it's anti-progesterone, and then you just threw down some progesterone and messed it up. So don't be throwing some extra Ella, or mainly if you just took Ella to prevent an unplanned pregnancy, don't throw down some progesterone.
Gotcha. And if you're on birth control and the condom breaks, what is...
Don't have to do anything. Just
Right.
need to get tested for sexually transmitted infections in a week. If you notice any nasty discharge, itchiness, or any sign of a sexually transmitted infection, because if they had one, they could give it to you.
Gotcha. That makes
But
sense.
you don't need emergency contraception if you're already on the pill, the patch, the ring, the IUD implant, and the condom pops. It's just if you're on nothing and the condom pops, yes, you need some emergency contraception.
Yeah.
Got
Great
it. Okay,
example.
That makes a lot of sense.
I like the examples.
Yes. One more thing on my end. I saw a TikTok the other day. I get all of my so true information from there, 100% factual, of this girl saying that she found out that you could skip your periods on birth control. Great. Love this start. That is true. But then she was saying that the bleed that you have during it is, she was also correct, not a real period. It's just a reaction to the change in hormones. Yes, great, still correct. But then she said that during that time, if you have sex and you're not using protection, you can still get pregnant. So I was going to say, if you've taken the 3 rows of active pills, then you're set, right? You should be fine.
As long as you've taken 3 weeks of active pills before you decide to come off. So let's say you did 6 weeks. Well, you already did 3 weeks in a row right before you came off. But if you did 2 weeks and then you decided to have a bleed or whatever, then you wouldn't be protected, because you need the 3 weeks to shut things down, and then you're protected. So you are not at risk during that withdrawal bleed if you've at least taken 3 weeks of active pills before then. But if it's only been 2 weeks and you decided some reason to stop your pills and have withdrawal bleed, then you'd be at risk of pregnancy. And maybe she was confusing it with, I say a lot, that the normal 3 weeks on, 1 week off is actually too long, the research has shown, for a lot of people with a higher BMI, because this was based on when the birth control pill was 110 micrograms of estrogen. And now we're down to 30, which is, a third of that ish, or even 20 micrograms for those women that are 30 or over. And so they've noticed on day 5, 6, or 7, there may be escape ovulation, which is the egg coming out. So maybe she heard me talk about escape ovulation if you're off on day 5, 6, or 7 of the normal birth control pills, or just in general, anytime you come off. So they'll notice in the newer pills, they have 4 days off, and then they'll have either 4 days of some estrogen pills, or they'll just start the new pack now or something like that. So I would recommend if you're gonna have a withdrawal bleed, 4 days max off. But in general, why have withdrawal bleed at all?
Right. Yeah. And I remember you saying too that kind of resets your whole system rather than keeping it all nice and kind of at bay. So at that point, you can increase your risk of certain things we were talking about. I'm blanking on what they were, but you can feel worse.
So in the old days, we used to say, if you're trying to get to no periods, just keep taking the pill, just keep it. And if you had breakthrough bleeding, suck it up. And this is an instance where if you're gone more than 3 weeks and you're at like 6 weeks, 8 weeks, and you're like, come on, I want to get to 3 months, or I want to get to 6 months, and you're having breakthrough bleeding, nah, I'm just gonna, keep trying. But then the blood just keeps coming. And then it's time to come off for 4 days, let the uterus clean itself out, reset the clock, and then try again. And for a lot of people, you can get farther each time. So for me, the first time I broke through at 3 months, and then the next time it's 6 months. And then after that, I was home free. I had another friend, she had polycystic ovarian syndrome. So her periods were irregular to begin with. She started it, never had a period again, as long as she remembered to take her medicine. But then you got to watch out for the 28-day lady. So if you are every 28-day woman and just every 28 days and you try to go without your period, sometimes you may need a stronger birth control pill to take over your system. Or sometimes you're doing fine for years and then a new person with a uterus enters your life, specifically my 14-year-old daughter. And so I noticed that if, not with hers particularly, but I was in a living situation for 2 weeks for a startup camp, and my roommates were all 21-year-old women. And then all of a sudden, bam, I got my period. And I was like, I'm a doctor. I take my medicine every single day. I haven't had a bleed in like 3 years. What that, and then one woman's like, ha, I got my period. And the other one's like, ha, I synced up too. And so these like very nubile, very fertile women had pheromoned me, and I had caught their period. So if there's a new person in your life that with a uterus who has very strong every 28 days, they can infect you with their period. Watch out.
That's a real thing. Yeah, people used to think that was a myth, but no, the pheromones, they're very strong.
They're legit.
Oh my goodness.
There have been 2 research studies on it, and it said that it wasn't true, but I believe that if I'd done it, it would have been done better, which is you need to figure out what are the cycles of the people, how many hours do they spend together, because you have to sleep together for at least 8 hours or be in the same enclosed room. So if maybe you and one other person share an office, then you can get it. And my chiropractor is that person every 28 days. On the flip side, that can be used for fertility. So I think that's a future thing. We'll like have a woman and we just pay her because she's every 28 days to sleep every night with these women that want to get pregnant, not sleep with them, but in the same room at the Four Seasons or something. And it'll be a natural way to get people's fertility up.
Oh, we should discuss that more.
Yeah, anybody who wants to have a baby and is having problems with your cycles, go be dorm mom for a sorority.
Yeah.
Or all girls school or all girls dorm or something.
Absolutely.
Very true. Awesome. That is it on my end. Aariyana, if you want to ask one more kind of like wrap up question, go for it.
Yeah, so I have another wrap-up question. It's funny that you said everything about how women and their uteruses kind of interconnect with each other. That's actually happened to me a lot. So I was going to ask as well for our wrap-up question, what's the number one thing that you would want our audience to take away today from learning about birth control? What's the number one, I guess, myth to debunk, or the number one thing that all women should know about birth control?
I think what I want people to know about the birth control pill is that there are 40 different birth control pills and there are 8 different progesterones. So if you tried one and it made you crazy or you gained weight or you got hairy or you got acne on it, know that there are 39 other pills, but there are at least 7 other progesterones. So it's really important when you see your doctor, if you don't remember, at least just take a picture of your pill so that we know the name of the progesterone and the dose, because sometimes at this dose, it causes acne and munchies, but at this dose, you're perfectly fine. But also know that there's 7 other progesterones that you could use. The other tip, because I can never just give one, is that not all birth control pills companies are made the same. Look at who is the CEO, look at what are their values, but more importantly, do they list the first and last name of the doctor? Does the doctor specialize in birth control? Are they passionate about women's health? Because I've written 2,000 birth control prescriptions in the past 2 years and more now, because I've been saying this for a couple months, and there's more that I've written. And, as an academic and the only academic CEO doctor of a birth control company, I've looked at the side effects by ethnicity, by BMI, and we feel that we give women the best option if you've never been on birth control that will have the least amount of side effects. And then when you get side effects, because I'm academic and scientific, we look at the literature and say, oh, is this an androgenic effect? Is this a progestational effect? Do we turn down the androgen? Do we turn up the androgen? Do we turn down the progesterone? Do we turn up the progesterone? And not everyone gets this level of education or looks at this scientific evidence. And so we've trained all our physicians on our protocol, and we share freely that information. We have a blog post on it, managing side effects, so you can send that to your doctor. And it links to a Google Doc where I put in a giant spreadsheet, all the drugs and by their progestational androgenic side effects. So who the CEO is, who the staff is, makes a difference in a company. And I really appreciate Sarah and Aariyana being our ambassadors, getting out the word on social media.
Yay. Yeah, I love that. That was a great wrap-up question. That was perfect.
Thank you.
Yeah, that was perfect. And I'm really glad that we can spread the word too, because I definitely could have used a lot of this information when I was first getting on birth control. I actually remember my doctor said, or I don't remember if it was my gyno at the time or my primary care, but one of them said that a lot of gynos will just prescribe pretty much everyone the same birth control unless there's something like drastically different. And I thought that was really interesting because I was like, well, yeah, like they do similar things, but not all bodies are the same. And so I thought that was very interesting. So I really like what you said about how, yeah, it's great at Pandia that we really look into the research. We consider all of the history, every other conditions that the person has. That's really awesome. So yeah, on that note, that's a perfect way to kind of close this out. Pandia Health, we are now in 8 states, right? We're in Arizona. 9. Wait, we're Colorado, Georgia, I know. Woo! Nevada, Florida, Arizona,
Texas,
Wyoming, Texas,
and Washington.
Washington, yes, that's the new one. So we can prescribe to all of those states. You can set up an online doctor consultation. We're sending out a new discount code actually for the hashtag Stop AAPI Hate. So, two good things. So be on the lookout for that if you're interested. And if you're not in one of those states, no worries. You can still sign up for our free delivery service. So just a little caveat there, the birth control itself, there might be a small copay depending on your insurance. You may not have one at all, but it'll be small if you do have one. And otherwise, without insurance, it'll be $15, I believe.
For most birth control pills, unless you demand a specific name brand.
Yeah. But the delivery itself is free. So you don't have to you don't have to worry about driving, wasting your gas, or walking in the rain and the cold to get your birth control. You get it delivered. And it's always
comes with a goodie.
I was going to say, it's also very on time every month. I've noticed it's very I always know the day it's going to come. You can track your shipments. If it's delayed by a day, which it usually isn't, but at one time that happened to me because of the holidays, and they immediately let me know, the patient care advisor, which was great. So you could, have a backup if needed. So yeah, check us out. Also shout out to Aariyana for joining us on tonight's live. You'll be seeing her face quite a lot after this, so be on the lookout for her. We'll be back again next Tuesday with another Trendy Tuesday topic, so don't forget to check it out. And other than that, I hope you all have a great evening. We'll see you next week.
Thank you.
Bye.